We've been talking about abstinence until today. We're going to talk about the consequence of abstinence, whether it actually will raise antibodies against your sperms. In fact, there is a belief that the sperms itself is only half of the body's genetic material. As a result of that, there is this barrier called sperm-blood barrier. When that barrier exists, then the white blood cell or our body's defense system will never be recognized in order to cause problems in the sperm itself. However, if there are problems such as trauma of the testicle or an operation or a vasectomy, then your body will build up anti-sperms antibodies actually attacking the sperms itself. So sometimes people believe that actually will reduce your sperm quality and also reduce your fertility. So does abstinence cause it? In fact, the study actually showed that there is no association with that. The other question that people ask is that does abstinence itself increase the risk of antibodies or immune system against your gametes in your partner? In fact, that is a condition called allergy to the sperm. You might laugh that, is there such a thing? Yes, however, it's exceedingly rare. Imagine that somebody on your partner who actually has a inflammatory reaction when there is an ejaculation in the vagina. And that itself can range from a very mild redness, rashes, and itchiness, and slight pain and swelling around the labia and the vagina, or it can actually extend to a spectrum of the full-blown anaphylactic shock, believe it or not. And how do we make the diagnosis? In fact, allergists or allergy specialists will actually do a specific test to identify that somebody is hypersensitive or allergic to sperms itself. As a result of that, how to overcome that problem? There are two ways. Number one, to overcome that problem to fertility is easy. The sperm itself fertilizing an egg for the treatment of IVF will create the next generation without any problems of allergy. However, if somebody is really having trouble with every time having sexual intercourse, the allergic reaction occurs, then a doctor from US called Dr. Desnick actually realizes that the graded sensitivity of sperms by using the exposure of the sperms to the female partner gradually might actually reduce their sensitivity, i.e. getting used to it. For the whole month of May, we're going to talk about different conditions affecting the scrotum, and we're going to start talking about a condition that is very common affecting scrotum by accumulation of fluid, a condition called hydrocele. Then stay tuned for next week, putting Dr. G on the spot.